I'm going to give you 1 minute to prepare, and then we start. So your 1 minute to start preparation starts now. So you can read your case loud, and then we'll take it from there.
So 70-year-old, a known diabetic who has come to your office to discuss his current situation. Last week, he refused surgery for the right leg, which has gotten infected. In the next 10 minutes, address his concerns.
Awesome. So yeah, I'll give you, 1 minute to prepare yourself. In the exam, you are given about 2 minutes, but I'm giving you 1 minute today because I'm sure it's evening. People need to also get going. We'll take it from there. So doctor, your time is up. Your 10 minutes starts now.
Okay, and good morning. My name is Dr. Ofori. How may I address you?
Please call me Mr. Smith.
Mr. Smith. Okay, what brings you here?
Well, doctor, I'm very concerned. Are you going to be okay if someone tells you that your foot has to be cut off? Is that fair? Is this the kind of life we need to live?
And I understand your concern. I know it will be difficult. Please calmly calm down and let me ask you some few questions to understand.
Well, doctor, I hope it's not just the usual doctor jargon you are using on me. I'm very, very frustrated about the decision the surgeon made. What kind of medical practice is this? Don't you have any other thing you can do for me?
Mr. Smith, I know this is a very difficult situation, and I'll ask you some few questions to understand what is going on and try to address your concern. Is that fine with you?
Well, let's see.
Okay, so what brings you here?
Doctor, I think I've already told you that I talked to the surgeon the last time who says that my right leg has to be cut off.
Okay, did he tell you why he has to cut it off?
Well, he says that I have an infection on my right foot.
Okay. When did this infection begin?
Well, it's been there for some time. I don't usually see the doctor, so I thought that it was a usual, regular leg infection. Now he's saying that my leg has to go off. That is ridiculous.
And did you notice any sore on your leg some weeks or some days ago?
Well, it's been there. I've been trying to manage it at home. I didn't know it was this bad.
Okay, so and has it affected your whole leg or it's your foot?
Well, it's on my leg, and the doctor says that if he doesn't cut it off, it can spread to my. It's on my foot. The doctor says if he doesn't cut it off, it can spread to my whole leg.
Okay, what about your other leg? Is that fine?
Well, he examined it. He didn't tell me anything.
Okay. And do you feel any sensation in that leg?
Which leg?
Your right leg. The leg you said they are going to cut.
I have a lot of pins and needles. There are times when I step on things, I can't feel it.
Okay. And do you also get a feeling like foam when you step on the ground?
Yes, at times.
And have you noticed any color change to the leg?
Well, it's what it is. I don't really look at it, but obviously the doctor says there's been a change there.
Okay. And the pins and needles, how long has it been? When did you start feeling it?
Oh, it's been there for years.
There for years. Okay. So do you have any underlying medical condition?
Well, I have diabetes.
Diabetes. How long have you had this diabetes?
Oh, doctor, about 20 years.
Okay. And what medicine are you on? Are you on any medication?
It's been almost 1 year since I took any medication, doctor.
Okay. But before the 1 year, were you on regular medication?
I've tried several medications from, going to Mexico. And I seriously, with what the doctor told me, I want to go back to Mexico to go get some herbal treatment from there.
Okay. So, and 20 years ago, when you were told you had diabetes, did they put you on any regular medication?
Yes, but doctor, I did not. I always felt good, and so I didn't see why I should take that medication. Why fix it when it's not broken?
Okay. And were you educated on compliance? You need to comply with the medication.
Well, the doctor used to say, but I didn't feel sick.
You didn't feel sick. Okay. But were you also checking your sugar level?
No, I
You
don't have
never
time
checked.
to be pricking myself.
Okay. Then, okay. So for the past 1 year, what caused you to stop the medication?
Doctor, I've told you, I wasn't feeling sick. Like I feel good in my body. I'm able to walk around. I don't go to the emergency room with any headaches. Why should I take medications?
Okay. Did you notice like urinating more frequently than normal?
Of course, but they are saying it's one of the signs of diabetes, but you know, I'm cool with that.
Okay. What about drinking a lot of water?
Sure. Like what I'm
And
doing right now.
okay. And did you notice any increase in the way you eat? You are eating more than normal.
Of course, I love my food, doctor.
Okay. Have you noticed any loss in weight?
Yes.
Okay. What about your vision? Are you able to see clearly? Or you have
Well,
vision?
I had to be called by the SGI to go look at my eyes, but I've not had any cause to worry about it. I have an eye doctor appointment pending, which I've not really bothered to go see.
Okay. Have you noticed any swelling of your legs?
Not really, doctor, apart from the wound on my leg.
What about your face? Have you noticed any swelling of your
No,
face?
doctor.
Okay. Then, so, and do you have any other medical condition?
Well, I'm told I have high cholesterol and some high blood pressure as well.
And what medications are you for those ones?
Doctor, those medications are big names. I don't even remember the names.
Okay.
But I
But
don't even take them. I don't take them anyway.
do you have any reason why you don't take them?
Doctor, I've told you, I feel good.
But what about the blood pressure? Have you monitored? Have you checked it before?
Doctor, I feel good.
Okay. And we'll go to and ask you some questions about your family history and social history to understand and further things about you. And do you have any family history of hypertension?
Well, my father had high blood pressure, yes.
What about diabetes?
My mother did, and my brother as well.
Okay. So, and as we move to the social history, the questions we'll ask will be a bit more confidential, but we rest assured that any answer you give to us will be kept confidential unless otherwise requested by law. And do you take any alcohol?
Yes, doctor, I love my drinks. We just celebrated Canada Day. I took about 8 bottles with my friends.
Okay, and how long have you been taking the alcohol?
Oh, doctor, almost 30 years.
Almost 30 years. Okay, and have you felt the need to cut back on your alcohol?
Doctor, I don't want to talk about that.
Okay, we understand that. But we'll try and address the alcohol issue on the next visit. What about smoking?
Yes, I smoke as well.
And how many sticks or how many packs do you take in a day?
1 pack a day, doctor.
And how long have you been smoking?
Around the same time I've been drinking, doctor.
Okay. So we'll also try to address the smoking issue on your next visit. And we are going to ask a bit more sensitive questions. And do you take in any illicit, have you used any illicit drugs?
No, doctor, no, no, not me. No.
Okay. What about, and what work do you do?
I'm a plumber.
You're a plumber. Okay. And who do you stay with?
My wife,
And how many children do you have?
doctor, 2 of them.
Okay. And how do you feel about your condition?
Well, doctor, I feel good in my body, but I'm surprised that the doctor wants my leg cut off.
Okay. So do you have any expectations for us?
Well, doctor, tell me that there should be other options, or else I want to go to Mexico.
Okay. So we understand what, so we are going to talk to you about what is bothering you. And we understand that you've had an infection of your leg, which seems to be spreading. And it usually happens because of the diabetes when it's not well controlled. And as it goes up, as you were told by the other doctor, it can affect your various parts of your body, which may worsen your situation, cause and organ damage and eventual death, which we don't want to happen. And I'm sure the doctor has considered all the various options, and he's considering the amputation because he doesn't want the infection to spread further to cause what we call sepsis. Okay. Then we'd also like to tell you that we have alternatives. We have, once the amputation is done, we have prosthesis, which can be given to you for you to live an almost normal life with rehabilitation. And also for the infection, we'll also give you some antibiotics to further treat it so that it doesn't spread further. Do you have any question?
Doctor, apart from cutting off my leg, is there any other option?
Yes. So as I said, and we can give
Dr.
you
Furi,
some.
your time is up. Okay. Thank you very much. Thank you.
Can you all see now?
Yes, please.
Okay. So well done, Dr. Ofori. And I made some notes whilst you were presenting. And I like the composure. You remain very composed and very calm, which is a good strength. Throughout my presentation, I'll be touching on some of the things that I felt we could do better and use that to elaborate on how the MedCognito structure is. I can imagine some of the people listening to us, and I assume a lot are preparing for the NAC. And I know that at this stage, there's a lot of anxiety. People are very nervous. People are very anxious. I just want you to know that I have been in your shoes before. I've been listening into a MedCognito lecture just like you are. So I can relate to how you must be feeling. And I can relate to the emotions and the uncertainty and all the doubts you may have in your head. But what I want to say with you is that if you can remain committed,
Dr. Les,
for
can you kindly raise your voice a little bit?
can you hear me?
Yeah, we can hear you now. Yes, please.
If you can remain committed for the next few weeks to the structure and this approach that I want to share and that Dr. Boni will also be sharing with you, I can guarantee that you are going to get your pass with superior performance, 100%. And I'm confident about it because I have used this approach myself and I got the superior performance. And I'm not saying this to brag or to praise any extraordinary abilities that I have. It's something that I think is well within the reach of all of us. All that you really need is just to show that commitment and to devote that time, and you will get that result. Okay, so first of all, let me go to the next slide. So this is the approach when you are taking cases generally. The first thing is to read the vignettes carefully. The instruction that you will see at the entrance of the door, or in your case, since it's a virtual exam, it will be projected on the Simulation IQ platform. You need to read it carefully. That is the first step. You need to read it carefully, and I will recommend reading it at least 2 times. Okay? Please take note of this. If you forget anything at all from this webinar, it's the fact that you need to read the vignettes very carefully. I would say read it 2 times because often there are clues that are embedded in there. Okay? The next thing is after reading the vignette or the case scenario, you need to look at identifying the task. What task am I being asked to perform? Okay. And then the next thing is to write key information. When I started with MedCognito, I was writing so many mnemonics on my sheet. And that's what I was practicing. I'm going to write so many. This is for the history, this is for the past medical history. With time, you realize when you're using the MedCognito approach, you tend to write very little, which is something that we are going to show you and we are going to practice with you until you become perfect. You don't have to be so intelligent. You don't have to have so much knowledge. There's an art and there's a structure to this. And if you stick with us and you remain committed, you will achieve it. That's what I want you to know. So you need to write only key information. You don't have to write so much. One of the key information is write the task, because you can often forget it. In the whirlwind of emotions and excitement and all that, you can easily forget your task. So write the task. If it's history, write history. If it's history and physical examination, write history and physical exam. If it's address patient's concern, write address patient's concern. What I also did was to write the patient's name, because trust me, it's very important to be able to mention the patient's name in the course of the discussion. All right. Then you knock and enter. Okay. In my batch, it was practical. Now it's going to be virtual, and they're going to give you instructions. So this bit may change, but we'll see how the simulation IQ, because that's the platform you're going to use, what the MCC is going to come out with in terms of how to enter the station, right? They are going to show you a video to give you an idea of how that will go, all right? But when it was in person, you would knock and enter the station, all right? So we usually have what we call like a MedCognito approach, which is what I used during my exam, is that you need to have a structure in your head. You're not going to go into the station empty-headed, all right? So this case looks at refusal to consent. All right. Now, remember that the principle of consent is very key in interacting with patients. And the consent in this case is not just about surgical procedures in this case, right, which is a diabetic who has refused surgery, but it applies to all forms of procedures, diagnostic or curative, where you're going to do something that is going to affect the patient and it's deliberate. You're going to intentionally interfere with the patient's functioning in one way or the other. All right. Now, this case scenario can come in different forms. You may have a situation where it is a patient who is refusing chemotherapy, for example. You may have a case where it is a patient who is refusing, let's say, nebulization, for example. All right. You may have a case where it is not even the patient involved himself, but the proxy, let's say the parent, refusing some procedure or some treatment for his or her child. All right. Now, the principles are the same, regardless of the scenario. All right. So, like I said, metacognitive structure, you enter the station, you need to introduce yourself, and you need to set the agenda. But there's a hint, and I'll get to it in a second. You need to set the agenda. Please set the agenda in quotes. All right. Now, it's always important to scan the patient's mood and empathize as appropriate. Okay. So this is where Dr. Ofori did well. However, you will all bear with me that this patient was agitated or very frustrated, all right, or very hostile at the beginning. Now, all the patients that you will have in your exams are all actors, all right? And they have been given scripts and they need to act out these scripts. And remember that anything a patient is doing or a standardized patient is doing in an exam has a reason, and you need to be very conscious about it. So anytime you see a patient showing a certain form of emotion in a clinical encounter, you need to label the emotion. Please write this down or take note of this. Label the patient's emotion.
So, Dr. Alex, how do we label emotions?
Exactly. And I'll give you an example, and we'll be expanding on this throughout the course. We'll deal with various forms of emotions and how you label it. So, for example, you go in as Dr. Bruni was showing, how is this fair? Is this how you would want? You must say something like this, and you must say it in an empathetic tone. Mr. Smith, I can see that you are very frustrated, or I can see you are very upset. and I'm here to discuss that with you, and I'm here to address your concern. So you must label the emotion, and that is a way of calming the patient down, and introduce the concept that you are here to address their frustration, or you are here to address their concern. Similarly, if you enter the station and the patient is down or is in tears, you need to mention the patient's name. Miss Smith, I can see that you are very distressed. I can see that you are down, and I'm here to help you, or I'm here to address your concern. All right? So you must learn to label the patient's emotion and do it in an empathetic manner. Trust me, of the competencies that they are looking for, empathy and communication, perhaps, in my opinion, is at the peak, because everybody can take a history, but not everybody can do it in an empathetic manner. And that's what the MCC is looking out for, right? Everybody can be a doctor, can just go through a strict, how are you feeling? What are you doing? How are you, but they want to see, is this an empathetic doctor? So that's one thing you must notice, and it's something I feel Dr. Ofori didn't quite address. You should have labeled the emotion and said that I can see you are very frustrated, Mr. Smith, and I'm here to help you, or I'm here to address your concern. Mind you, the task you are supposed to perform is not a history and physical exam. The task is what? Address the patient's concern. So we'll get to that in a short second, in a short while. In the next slide, we'll talk about it. So when you also begin, it's always good. Let me go back. It's always good to ask an open-ended question. Always start your interview with an open-ended question. All right? Always start your interview with an open-ended question. The open-ended question will help you to understand the patient's, you will elicit the patient's understanding, and it will guide you. Okay, because when you enter the station, you should not have a preconceived idea in your mind except for the task. So in this case, your task is you're going to address the patient's concern, but you don't even know the concern. Now, how will you manage or address the concern when you don't even know the concern in the first place? So you need to ask an open-ended question. And we will teach that in the course. How do you ask an open-ended question, right? So that the patient can guide you as to which way you have to go. Now, so this is what we call the MedCognito paradox. And it's a paradox because it sounds almost contradictory. As I said, when you're entering the station, you have an agenda. Your agenda is to what? Address the concern. Your agenda is that you want to execute the task you have been assigned. So in this case, the case scenario says address the patient's concern. So you have an agenda in your head, isn't it, as you're entering the station? But the real agenda is set by the patient. So you set the agenda, and then you let the patient set the real agenda. And it sounds very contradictory because you want, I have an agenda in my head, but in fact, it's the patient that sets the real agenda. So the way I see it, it's a sort of a balance, all right? It's a sort of a balance. You come in there, I quickly want to finish this station. I want to excel. I'm going to, quickly go through my task. But it's the patient that sets the real agenda. You are just going to be poking here and there and allowing the patient to set the agenda for you. All right. Now, for this case, you're supposed to probe more into their understanding. For example, this patient has refused surgery just last week, and you enter the station, the patient is frustrated. You need to label the emotion. Mrs. Smith, I can see that you're very frustrated and disturbed. I'm here to help you. How can I help you? Or talk to me. What is making you frustrated? Or what are your concerns? Because that is what the task is asking you to do. So then he comes to tell you, I came in here and your other colleague, he wants to cut off my leg, and I refused outright. I said no. Then you guys tell me more about it. You can say something like, tell me more about it. That's an open-ended question, right? So you'll be like, doctor, cutting off my leg. I mean, how do how can I live? So now you need to tell me more about it. What do you mean by this? What are your concerns about it? Do you understand? Then you ask something like, how long have you thought this way? And why are you so concerned about this? Why what is the what do you have? What are your thoughts about it? Then they tell you that, when you cut off my leg, maybe I'm a footballer, or I'm a community volunteer, or maybe I like to run a lot, and so that's why I don't want, I'm refusing the surgery. There are so many reasons why someone is refusing a procedure. And the purpose of this task is to show that you are skillful in terms of taking a history, in terms of gathering information, so that the patient will tell you why. Because you need to understand why the patient has refused and try to address it. I don't know if I'm making sense or if I'm driving the point clear.
Please, if he's making sense, just say you're making sense in the comment section. Please,
Yeah.
if he's making sense to you, because we want to really see the interaction going on there. If he's making sense, just say that,
Yeah.
yes, I'm following or something.
Because the thing is, the actors are given a list of concerns. You are told, okay, if the candidate does this, this is how you react. If the candidate does this, this is how you react. And these are, maybe there are about 4 issues. Tell the candidate that you are an athlete and cutting off your leg will impair your life. If the candidate doesn't ask you why, you don't mention it. And if you don't mention it, the more things that they have that you, the candidate, are not encouraging them to come out with, it goes against you, because it shows that you are not skilled in eliciting history. All right. Eliciting history means you need to tease the information out of them. You need to make the patient feel comfortable to open up to telling you their issues, right? Now, on the checklist for this case, you, the candidate, will be expected to probe further. Like, did they discuss their decision with anyone? Have they thought of alternatives? You realize that when Dr. Boni mentioned that I'm thinking of going to Mexico, that was a cue. That was a cue that he was throwing at you. And you realize that sometimes there are thoughts. If the candidate is not mentioning any of these, maybe after 2 or 3 minutes, throw this cue at the candidate, and let's see what the candidate does with this cue, right? The cue is to help you. So the patient mentions Mexico. Straight away, you must ask, tell me more about this Mexico, right? Why are you feeling this way? Then they will now come out and tell you, I have a friend who, went to Mexico, and then you must address this concern. Sometimes the patient may tell you, well, there are financial implications of it, and I just can't afford it. I know this must probably be expensive. This is Canada. Everything is expensive, doctor. This is probably going to cost over $50,000, and I can't. That is why I'm refusing this surgery. So the fact that he has opened up to you gives you the opportunity to address the concern. So if at the end of the day, the patient doesn't open this up to you, you have lost marks because you haven't addressed the concern they have. I hope it is clear and everyone understands what I'm saying.
Yes,
So
Dr. Alex, it is clear.
You're supposed to come up with knowing what is in the patient's mind, like what alternatives are they thinking about? Have they discussed their decision? How long have they felt about this? Probe more into this. You need to ask why, right? You need to also ask if they understand the consequences. So, Mr. Smith, I appreciate that you don't want the surgery, but in your mind, what do you think will happen if you don't have the surgery, right? And they may say something, well, I know, the infection will just go on, and you just need to give me some antibiotics and I'll be fine. And this gives you the opportunity to explain that, well, Mr. Smith, I can understand, or I can imagine, but however, if we don't do the surgery, what may happen then is that it may spread into your blood, a condition we call sepsis, and you may need to be admitted, and it may need resuscitation, and it could prove even fatal sometimes, So you need to explain the consequences of their decision to them as well, right?
Yeah.
So I don't know if everyone is following the structure. You need to probe why they are taking the decision, how long they've been thinking this way, what alternatives they've thought about, if they have discussed this with someone else, whether they understand the consequences. And at every stage, if they come up with issues, try and see if you can address it. Try and see if you can address it, all right? And another thing, you need to rule out a mood disorder, because mood disorders can impair people's judgment and decision making. So how have you been feeling? You know, how have you been feeling of late? How is your sleep? How is your appetite? Do you have any guilty feelings? Are you able to concentrate? You need to screen them for any manic symptoms, and you need to screen them for any suicidal or depressive symptoms. I'm sure you know all these mnemonics, and we'll be going through the mnemonics in the course of time. CGCAPS and then GST paid is in Toronto notes. I'm sure you've all read it before. Whether you do any alcohol, whether they take any illicit drugs. And this is another hint. If you are talking more than the patient, you're probably not doing a good job. You're not supposed to be talking for long periods and the patient just listening. You're supposed to be talking for short periods and check in with the patient. How does this sound to you? How are you feeling about this? What do you think about this? This is the way to secure a superior performance.
Thank you.
You need to talk in for a short period, let the patient do more of the talking. You need to be coaxing the patient, you know, like encouraging the patient to talk. Okay, encourage the patient to talk. All right. And sometimes remember, they are actors. If you encourage them to talk, they may bring all their concerns very early and you score all your points. And then the rest is you setting the agenda and asking them periodically, have you understood what we've discussed? How do you feel about this? What do you think about this? Is there any concern I've not addressed, right? You need to also discuss what they think in terms of their healthcare decisions. Have they thought of anything? Have they heard of anything like an advanced care directive? Do they have any substitute decision maker? Do they have a power of attorney for personal care? Things like this. These are some of the things that are expected for this kind of case. All right, because this is someone who is refusing care for surgery for an infected foot, could easily become septic, could easily need resuscitation. Is this patient a DNR? Does he not want resuscitation? Has he accepted that, okay, he wants to just let his life go?
Dr.
Right?
Alex,
So
so before you continue, Dr. Blessy K. Joy says, should we talk about advanced directive for this case?
yes. So for this case, you need to. And you need to because, as I was explaining, you need to, this is care, right? This is refusal to consent, right? You must have in your mind, this is your patient who has restrictions for certain things, right? This, you would expect that, oh, this is a diabetic foot and it's getting infected. We need to do some surgery. We need to do debridement. If it's very extensive, we need to do some amputation. But this patient is saying, no, I don't want it. So you must anticipate that this patient is going to be very circumspect. So you need to understand there's some aspects of the care that the patient doesn't want. So you are being a physician who is looking into the future. Maybe this patient may say, even if I become septic, I don't want any heroic measures. Now, how will you know if you don't ask these things, right? Because the patient is telling you, I don't want surgery. Maybe you say, I want IV fluids, but don't give me antibiotics. Maybe I want antibiotics, but don't resuscitate me if I could. So you need to have all this at the back of your mind. That is why you need to ask this, because this is care and he's refusing surgery. What else will he refuse? You need to know, what else is this patient likely to refuse? I hope I'm making that point clear.
Yes, sir.
So the next thing is that you need to explore their social situation. How are they supporting themselves financially? Are there any financial barriers contributing to this decision making? Right? Who do they live with? Do they have any support system? Are they being forced to take this decision? Is there any support you can give? Because for all you may know, this patient is worried because they feel that if they go for the surgery and they come back home, they live alone. they can't support themselves, right? And I like the fact that Dr. Fori mentioned the point about prosthesis, because that's something you must mention for a case like this. Because the patient may think that, my leg is amputated, I'm going to be holding crutches and it's going to affect my functionality. But if you let the patient know, the doctor, what do you think? I mean, you're going to cut off my leg, I'm going to be a cripple. You're like, and you always need to validate the patient's emotions. If they say, I'm going to be a cripple, you say, that is a reasonable concern, Mr. Smith. It is, I can imagine how you must be feeling. This must be very difficult. You need to always validate, or you can even, there are times when you just need to go like, I see, I can imagine. You need to let the patient know that you are with them throughout. You understand what I'm saying? You need to let the patient know that you are with them, and you are not just, you don't have your own agenda as a doctor and you just want to convince them to go for the surgery. You need to be open-minded, right? Then the next thing is, we talked about this, right? You need to be checking in frequently with the patient. Okay, and we'll expand. How do you check in? How do you reflect? How do you empathize? Because to me, that is the difference between a pass and a superior performance. How do you validate a patient's concern? All right. Now, assess. You need to assess if they are amenable to change their decision based on the information you have given them. And you have to affirm that ultimately they are in charge. They are the masters of their healthcare decisions. And irrespective of what you say, right, you are there to support them. This statement, you need to make it if you want to have a superior performance for this case. Because the fact that the patient is refusing surgery doesn't mean that you are not going to be with them on the healthcare journey. They have every right. You can say that, Mr. Smith, I can understand this must be a very difficult situation you are in. Or you maybe not even use the word understand, because some people take it differently. You can say, I can imagine this must be a very difficult situation to be in, and I'm here for you. I respect every decision you take. All right. I can imagine that you have decided, or I can relate to the fact that you've decided not to go for this surgery. If at any point in time you want to talk more about this, or you want to change your mind, I'm here for you, and we can have that discussion. Or based on all that we have said, how do you feel about this decision now? What do you think about this? What do you think? How does it sound to you? Be like, doctor, I have a lot going on in my mind, and I think I'm gonna give this some thought about it. When you've done this, it means you have been a good doctor. You have provided information, you have listened, you have adjusted what they've said, you have thrown it in, and now you have gotten the patient thinking, and you're like, sure, Mr. Smith, I'm here for you anytime. I'll just give you a little time to think about this. And just to caution you, this is a very critical situation, but you have a little time. Do think about this, and you have the office line. You can call at any time, and I'm here to help you. You need to throw in the statement, no matter what. You need to let them know that the patient has autonomy, and you, the doctor, is there with the patient regardless of the decision they make. This you need to say if you want to make a superior performance for these kind of cases, when it seems as if they are throwing or refusing, or it seems what they are doing is, like, in a way we'll say it's harmful. Can't you see you are going to harm yourself by refusing this surgery? Can't you see? So this, in a nutshell, I wouldn't want to take so much of your time. This is in a nutshell is what we expect from a case like this. I'm going to end here, and I'm going to take any questions. Or my colleague, Dr. Delusha, is here. I wanted to also make some statements on this. She's probably going to add more.
Sure.
Thank you, Dr. Alex.
Sure.
I actually don't have much to add, because I think you did a very comprehensive job in laying out what MedCognito's style is and the key concepts that we need to keep in mind. when addressing a case like this. And I think you nailed it when you said that probably the most important takeaway is to read the STEM multiple times and focus purely on what they're asking. So I'd like to also thank Dr. Ofori for his bravery in taking up this case. It is quite nerve-wracking when you're on camera and you're being observed by so many people, but I think it'll be a great primer for what is to come, because I believe that the next session of NAC is going to be offered virtually. And so I think it's quite important to get very comfortable with being observed like that. And as well to remember to make eye contact, because it's not natural for us to stare, right at the camera. But I think that's one more thing that everyone should probably keep in mind when you approach this exam. So I think you already covered FIFEing the patient. That's also one of the key things that I learned with MedCognito, and it really went a long way in helping me gain that superior performance score as well. So I just want to say that a few of the pearls that I learned from Dr. Brony was that practice, there is no substitute for it. You can listen to lectures, you can, watch those geeky medics videos, you can watch all of that, but really there is no substitute for practice. So practice, and in terms of practice, what I'm saying is to rotate your partners regularly. Don't practice with people that you're too comfortable with, that you speak the same language with, because you tend to sort of be in that comfort zone. So push yourself, practice with people from different specialties whose backgrounds are different from your own, and practice in the language, English or French, that you'll be taking your exam in. As well, I would say that—
So Dr. Denisha, quick question.
Yes.
How many cases should I maybe practice a day when I'm not in class with maybe the tutor? How many cases should I practice in the morning? How many cases should I practice in the afternoon? How many cases should I practice in the evening? Can I practice with my husband or my wife who doesn't have any, medical knowledge? How should I do it when maybe my friend is at work who needs to practice with me? What do you suggest?
I would say every free moment that you've got, you really should be putting it into this exam. Like what you put in, you will get out of it. So I know that a lot of the people who are preparing for this exam have kids and jobs and other sorts of responsibilities. And I did as well work during the time that I was preparing. So every waking moment that I was not working, I was practicing, and I would do at least 3 to 4 hours every evening.
Awesome.
So just in terms of taking turns, that would amount to anywhere from 5 to 10 cases, depending on how complex the cases were.
Sure.
So really daily, and on the weekends when you have a bit more time, just inject whatever time you have left into this, because you really will get what you give in. And to answer Dr. Brony's question about, practicing with people who aren't medical professionals, I think that's perfect as well, because your standardized patients don't have a medical background. So they might ask you these questions in a manner that a real patient would. So that gives you, the practice of trying to figure out how to explain that in lay language as well, which is an important skill to have.
Awesome. Thank you.
In addition to that, I would say really take the mock exams that you will have the opportunity to do throughout this course really seriously, because it really prepares you for the real life exam. And we got thoroughly grilled in the mocks, and
Sorry about that.
The real exam felt like a breeze compared to Dr. Brony's mocks. Okay, so if you take them seriously, you're going to be just fine in the exam.
Sure.
I also wanted to emphasize how important it is, and you will learn this in the course, to also be able to read investigations like the basics, ECG and X-ray, because you're going to get at least two of those, two stations where you have to do that. So be prepared with that. And surround yourself with positive individuals, because being an IMG in Canada, it is a struggle. You have to admit that, but you shouldn't let it overcome you. And that's one of the reasons why I chose MedCognito, because I could feel the positivity radiate out of Dr. Brony. He's a practicing Canadian physician who works in the ER. He does his family practice. He delivers babies, and at the end of doing all of that, he comes bursting with positivity. And we feed off that energy. So I was
Dr.
woken.
Delucia, I have a secret for you. I didn't tell you this. On Wednesday, I also passed my board exams in occupational medicine.
Oh, wow.
So now I'm also a board certified occupational medicine physician as well.
Amazing. One more feather in your cap.
Yes, please.
So yes, so regardless of how many responsibilities you have outside of preparing for your exams,
Yeah.
you should bring that positivity with you, because, you know, Dr. Brony brings it, and it really contributes to a positive mental space, because there is quite a bit of negativity out there about this whole process and all of that. So that's something that really kept me energized throughout the whole process. So yeah, use MedCognito to the fullest, build your network, meet new study partners, and of course, benefit from Dr. Brony's mentorship, not just in terms of learning about the NAC and acing the NAC, but another secret is that Dr. Brony cares not just about you passing your NAC or your QE1, but also about your career. So he has offered up his valuable time to provide one-on-one mentorship to all of us to shape our career paths. And that's definitely a huge part of my success in matching in this cycle as well. So,
and what about the network of other doctors we bring after your NAC to prepare you for your interviews as well?
For sure, for sure. So Dr. Brony and MedCognito is a one-stop shop, really. Lots of services on offer from start to finish, and wherever you are in your journey. So I'm really thankful that I stumbled upon MedCognito, and I was really drawn to the overwhelming positivity and energy. And I'm really glad, and I have no regrets.
Sure. So one of these days, what is going to happen is that Dr. Delucia is the one who is going to grill someone who will come onto the stage, and she's going to come with a wonderful case. She's currently in residency, so she's busy. So I'm not going to keep her long. Dr. Delucia, thank you very much for passing through. And one of these days, you are the one going to take the center stage, because that's what we are here for. You know, she told me that when she was done, that Dr. Bonita is what I'll be coming to help with. I really appreciate it for your contribution towards the IMG community as well. Thank you, Dr. Delucia.
Thank you.
Thanks for the opportunity, Dr. Brony.
Sure. Thank you. Okay, don't forget, Dr. Alex, please, can you just touch on this while you try to finish up?
Yes, let me quickly touch on that. So FIFE, or fiving, as we say, fiving is very important. You always have to five. Fiving means that you need to ask how the patient is feeling. That's the F. They need to ask ideas, what they think about this. And then you need to ask how they are functioning, how the disease condition or whatever health issue at stake is affecting their functioning. And then you need to ask for their expectations. Now, it's a very nice way to summarize your encounter with the patient, and it shows that you are fulfilling all the CAN-MET roles, right? So you ask, how are you feeling about all of this? What ideas do you have about this condition, or how is this affecting you? How is it affecting your life? So if the patient tells you, you know, I play golf, or I played this, and because of this, how is this affecting your golf? See, it shows them that you are an attentive listener, right? And is there anything, so Mrs. Smith, I can see that this must be very difficult for you. I know we have discussed the plans in terms of how to manage this present condition. Is there any expectation that you have that I have not touched on? Is there anything that you have in mind? You know, and you don't need to make it artificial. You can five anywhere in the history as the patient brings it up. So if the patient, I can't sleep, and then you put it in, how is this affecting you? right? How is this affecting? Any thoughts? So that is the concept of FIFE, and it's a MedCognito secret, and we FIFE a lot. In MedCognito, we say you need to FIFE the patient. If you don't FIFE the patient, you haven't completed the task, right? So please always remember, if you are leaving this webinar with nothing at all, remember FIFE. Feeling, ideas, function, and expectations. Very important, all right? Yeah. So, Dr. Bonnie, maybe we can go to any questions that people have.
So what about schedule up to discuss this more? Because, yeah.
Very important. Like I said,
patient is coming around.
There's so much we will share that time won't permit us to exhaust all that, but we'll be doing that in the course more in detail and in depth. And you get to practice so much that it will become second nature.
Awesome. Right? Awesome. So, you know, so you have to make your conversations real, as you said. And then the tone. You know, many of us did not grow up in Canada, and the kind of medicine we practice was a bit paternalistic. You've got to take your medications. You've got to do this. No. In Canada, you've got to always come to a consensus with the patient, come to an agreement with the patient. Even if it is something which is going to save the patient's life, you've got to always come to a consensus. Your body language must be an appealing one. You know, you shouldn't come across as forcing the patient to do things. And then your soft skills must also be good.